Hello, everybody. My name is Borislava Ananieva, and I'm the EPF Youth Group and Capacity Building Assistant. I'm very happy to welcome you all to today's launch of the Work and Youth Strategy project results that the EPF Youth Group has been working on for quite some time now. And we're very happy with all the information that we've gathered. We're very thankful to everybody who helped us get where we are right now. And I'm very excited to present to you all of the valuable information that we managed to collect. First, I would like to share with you some housekeeping rules. If you would like to minimize the control panel, you can click on the orange arrow in the up left corner. If you have any questions, you can ask them by typing into the question box and in the chat box. We're going to have some people that are going to help you out with that. With this, I would like to hand over the words to Anastasia, the EPF Youth Group Vice President, who is going to present to you a bit more about what the EPF Youth Group actually is and what it does. And then we're going to move on to ways. Anastasia, the floor is yours.
Hi, so my name is Anastasia Seaman. I am the Youth Group Vice President, and I'm a patient of a rare genetic disease, and I'm here to present a little bit about our youth group. So first and foremost, the European Patients Forum is an umbrella organization of patient organizations across Europe and across disease areas. EPF 75 members include disease-specific patient groups, active at EU level and at national coalitions of patients. We, as the EPF Youth within Europe, and especially through EPF, such as projects that we hold like the EPF Youth Strategy, and as well as through the EPF Board Youth Representative, whereby one of our members represents us as the youth on the EPF board itself. We are made up of 11 young patients, and we're representatives from all across Europe and disease areas, including but not limited to rare diseases, spina bifida, and beyond. Tomorrow, on November 19th, we are launching our recruitment call for new members to join our wonderful team, and we would love to see as many of you apply as possible. So please follow our social media platforms on Facebook, Twitter, and Instagram at European Young Patients and at EPF Youth to find out more. And you will also be receiving an email about how to apply. The recruitment period will close on the 10th of January, and we're looking forward to the new members that will be joining us. Today, we are presenting our topic on the work and youth strategy, but as a group, we cover and develop projects over a large spectrum. We hope that you enjoy this webinar this evening and that it encourages you to join our big, loving youth group family. Thank you.
Thank you so much, Anastasia. That was very interesting. Now I would like to give the floor to Andreas and Yolita, who are the ex-EPF Youth Group President and Vice President, who actually were in charge of the youth group when this idea was born. So it will be very interesting to hear from them why this project was needed, what were even their first thoughts beginning this, and I'm very excited to see you all online. The floor is yours.
And so good evening. Thank you, Bori, for the nice introduction. It is a pleasure, and it is a really vision that came true with today's webinar on WAYS report. Employment was one of the first topics that we, the EPF Youth Group, recognize as essential for young patients. We started with our first initiative on employment back in 2016 when we participated at the European Youth event in Strasbourg. At this event, we tackled the physical and emotional symptoms of chronic conditions together with social stigma and attitudes, which create significant barriers for young patients in the job market. With the appropriate support, us, young patients, like all enthusiastic young people, of course, we can be great assets for employers Therefore, it is essential to overcome such barriers. We decided to focus on the topic of employment during our spring meeting in 2018. We believe that it is crucial to assess young patients' needs and to provide better understanding to all kinds of stigma faced by young people with chronic conditions today. We believe that equal access to working opportunities and working in a tolerant environment is an essential human right and help young patients' integration and inclusion in society. So why this project was needed for the young patient community? It was needed because the results of this research will provide evidence on the experience of young patients in the job market. Such evidence can support stronger evidence-based advocacy, which will lead to a greater impact. With these results, we will make a valuable contribution towards fostering self-awareness and self-esteem in young people that are looking for employment across Europe. So you can understand why this was really important to us. And I will give the floor to my then other half, my Vice President, Yolita, for the rest of the opening remarks. Thank you.
Thank you very much, Andy. You said it perfectly. I want to personally congratulate the young group of EPF for the effort, for the long hours of work, for the dedication and determination that you showed in pursuing this amazing project. And for me, this project is really important. And tonight I think, is time for celebration, not only for the youth group, but also for the whole young patient community in Europe. And let me give you 3 reasons for that. First of all, this project recognizes that there is young patients community in Europe. Yes, we are here. Second, this project showcases the important topics for us, what we really care about, what are our needs and our expectations. And last but not least, this project emphasizes on the solutions that we believe in, that can suit us, our lives and our conditions. So tonight, let us celebrate together as young patients community, and let us never forget that we have voice and we are using it. Thank you.
Thank you very much, Yoli. I couldn't have said it better myself. Andy, the same goes for you. I think that's why it was so crucially important to hear from both of you tonight. And I'm very happy and thankful that you could be here with us and provide your inspiring feedback. Now I would like to give the floor to Yvette, the current EPF Youth Group President, who is going to present to you some insights, key results, and just basic information about the WACE project. And Yvette, the floor is yours.
Thank you, Borislava, and thank you, Yoli and Andy. It's really an emotional night for the youth group. And as you've heard from Yoli and Andy, why we started this project, I would like to talk to you about what did we do and how did we do it. So back in 2018, the youth group decided to implement a survey so we collect real-life evidence from young patients on how they are coping with finding jobs and keeping their jobs. And in December 2018, the WACE survey was launched. We had 62 respondents from 21 European countries. Our step 2 is starting this very night. It's dissemination of results and the recommendations. We have a very long report that we hope most of you will read, or whoever is very interested in our detailed statistics and results. But we also have a very nice, colorful composite fact sheet and a video which will help us to disseminate the idea of WACE and to put this problem and the potential solutions on the map. Next slide, please. So I would like to show you just a glimpse of the results we came with, some numbers popping up on the screen. 44% of those surveyed felt that finding a job was either difficult or very difficult. And this was even a surprise for us. That almost half of the patients, of the young patients, felt that even finding a job was difficult for them. 21% of young people identified prejudice against their chronic condition as a barrier to finding employment. And this is probably very much in line with our next number, which is the percentage of patients who said that they would not want to disclose their invisible condition under any circumstances. And we will come into very much details, and we will have very interesting insights from both on the advantages and disadvantages, those who are hesitant about disclosing their invisible illness, those who have to disclose their illness at some point because it's visible, and those who are not hesitant about it. Last but not least, only 5% of young people identified their wider community outside family and friends as supporting them in finding employment, which is, I believe, shows a very big gap for us as a society, and that there is a need for implementing new suggestions and the recommendations that we came up with. Next slide, please. Our key findings. One was that young people, every young people, have a difficulty in their early careers because they lack of experience. But if you're also a young patient, it might as well have happened that you've spent half or most of your childhood already having the disease, which may have prevented you from benefiting fully from regular education because of long hospital stays or because of general issues with health, preventing the young patient from taking full advantage of the education. So this is a very important barrier for young patients even before they could start thinking of finding a job. The next one is many of the respondents have already experienced negative attitudes towards them at the job market and their previous workplaces. And they identified these such as doubts in the specific needs that their condition requires, a lack of trust in the patient's professional abilities, and a psychological pressure to the patient to make up for the time he or she was away on sick leave or going for their hospital appointment. Third but not least, a significant amount of young patients would not disclose their condition before a job interview, as we found in the survey, in the fear of negative discrimination. So we believe that there's a lot of things we could and should do in order to change that. Next slide, please. So here comes our recommendations. We have three main recommendations. The first one is encouraging training for managers and employers to engage in better dialogue with young employees with chronic conditions. We think communication is key here. Employers should seek to understand the young patient's individual condition and circumstances and identify and implement together the support the young patient needs. And one remark, this should be led at all times by the experience and expertise of the young person and not the expectations of the employer. Second one is that we call for flexible working policies, such as adjusted work hours or the opportunity to manage workload around appointments if feasible by profession. We think this is important because these young employees with complex medical needs need these flexible working policies to be applied for their circumstances. And we believe that an inclusive workplace for young people and young patients will be also an inclusive workplace for everyone else. For example, those pregnant women or those families with small children. So this is a problem and this is a solution that reaches far beyond the young patients and the VACE project. Third but not least, if feasible by profession, and keep in mind that our recommendations and the survey happened before COVID, so COVID actually helped a lot for us with this one. But we believe that there should be greater opportunities for home and remote working for young people or for everyone else as well, so that young patients can make a valuable contribution to the employment market without the demands of traveling to work and working within environments that are not adjusted to their needs. These are our 3 main recommendations. We believe that inclusivity is key. We call for inclusive workplaces, and we aim to get there by open communication, flexibility, and trust. I would like to take notes, and on behalf of the EPF Youth Group, now thank to the whole European Patients Forum staff, everyone who helped us either in the survey or writing the report or the fact sheet video. We really had a lot of things to do, and we got tons of help. I would also like to thank experts or the experts in employment with patients. We got a lot of help from CRODIS Plus, from the CRODIS Plus consortium, and it was really valuable for us. I would really like to thank to all the EPF Youth Group alumni and the 2 EPF, especially for the 2 EPF coordinators who were the young youth groups coordinators, Ludmila and Borislava, for helping us throughout the way. So that's for me. That's all for me. Thank you very much. Borislava, the floor is yours.
Thank you very much, Yvette. That was I think, very informational, and I hope that all of our listeners tonight understand exactly what we mean by everything that we just said. Focusing on one of the main things that you mentioned earlier, I wanted to show the results of one of the key questions, I would say, in the questionnaire, which was, do you usually disclose your chronic condition before going to an interview? And as we're all aware, there are people that don't really have a choice in a situation like this because their conditions are visible, and it won't lead to anything good not to disclose before going to an interview. But as you can see, the results are very self-explanatory, I would say. And we wanted to go a bit deeper into the why this is. Has there been more perceptions towards young people with chronic conditions? Why would they react in such a way? And today we invited a few youth group members and some STIPA participants. STIPA is the summer training course for young patient advocates that EPF is providing for 4 years now, and it's been a huge success so far. And as you can see, there's a lot of young patient advocates that are continuing their advocacy work after all of these trainings, which is amazing to see. And today I would like to invite the people that you see on your screens to discuss the question, do you or would you disclose your condition at your workplace? We have representatives with visible chronic conditions, we have representatives with invisible chronic conditions, and coming from different disease areas, and I think it would be a very interesting conversation. And with this, I would like to give the floor to Jana Popova. She is going to tell us a little bit about her personal experience and why and how she made the decision that she did. Jana, the floor is yours.
Thank you very much, Borislava. Thank you for the invitation to participate in this unique online event. It is a great honor to be here among our other speakers. As you can see from the slide, my name is Jana, and I'm from Bulgaria. I'm a member of the EPF Youth Group, and I'm also a patient with spinal muscular atrophy, which is a rare neuromuscular disorder. I have been working in the field of media and digital communications for 10 years. Currently, I'm working as a lecturer in the Faculty of Journalism and Mass Communication. And I have to share that I have different and very, let's say, controversial experience with different employers, because spinal muscular atrophy is a visible condition. I'm myself a wheelchair user, and this means that I have to disclose my condition even before I'm invited to a job interview. And I have controversial experience with employers' reactions, because sometimes people don't mind about my condition, and they are more focused on my professional skills and on my working abilities. But sometimes when they hear about my condition, they are so confused and so worried how it is going to affect my work that they even refuse to invite me to a job interview. I have talked with different employers about that, and they share their main concerns. One of the most common misperceptions is that me, as a young patient with chronic condition, I might not be able to participate on a long-term project, or I might need more sick leave compared to my colleagues. Also, other employers share that they don't want to make any reconstruction in the working environment to make it more accessible for me. So that's why they refuse even to invite me to a job interview. There are different forms of discrimination that young patients with different chronic conditions, no matter if it's visible or invisible, are not good co-workers, and they are not able to do the same amount of work as their colleagues. Luckily, I also have some positive experience in this area with my current employers, because they were aware of my professional skills, and from the very beginning they were very cooperative, and they were trying to include me as much as possible in the working environment. For example, my current working place is located in a very old building, and the reconstruction might be very difficult. So my current employers offered me an opportunity to work from home, and in spite of this, to feel as much included in the working process as possible. They cooperate with me, and they don't have any hesitation or any concerns if I'm able to participate on long-term projects. They give me this opportunity to participate. So we collaborate together, and they provide me different opportunities to develop in the working field. And I believe that one of the reasons for this is because they had previous experience with other employers with chronic conditions, and also they were able to develop different internship programs for young people with different chronic conditions. So they could see how different chronic conditions doesn't affect as much as they think the working abilities of the patients. So that's why I think it is very good to have this discussion tonight about young patients' opportunities and equal access to job opportunities, because I believe that if we collaborate together with employers, decision makers, young patients, and patients' organizations, together we could provide ways for young patients to grow and develop in the working world. So I think this is basically for me.
Thank you so much, Jana. I think you really gave a very good overview of what it's like for a patient with a visible chronic condition to be applying for work, and all the difficulties that you might face. But it's really good to see the positive attitude behind all of this, and having in mind everything that has been going on with the WASTE project. I'm sure that we're on the right track for a better implementation. Next, I would like to invite Erin Page to share her experience and a few thoughts on why would she or why wouldn't she disclose her condition before a job interview. Erin, the floor is yours.
Thank you, Bori. So I'm Erin, I'm 25, and I'm originally from Wales, although I now live in Belfast in Northern Ireland. My decision to relocate to Northern Ireland actually was limited to the fact that for people like me, there were limited opportunities for career progression back home in the town I come from. I have epilepsy, and I've been living with the condition for many years now. I currently work as a recruitment and selection coordinator for a humanitarian organisation, and I'm very lucky that my condition hasn't impacted my ability to work. Neither did it impact my education. However, I firmly believe that it would have done were it not for the reasonable adjustments that were put in place for me at university and later on in the workplace. And I wouldn't have had those reasonable adjustments if I hadn't have made a disclosure. I am pro-disclosure, although I can fully understand why people might be hesitant to disclose their conditions. My condition is invisible, but not always. I quite often sustain injuries such as black eyes and things like that, which I'd find impossible to explain had I not already mentioned my condition. And I was very concerned about having to suffer in silence. There are so many things to consider, small things like the screen brightness, the lights in the office and things like that, that might trigger a seizure or affect my epilepsy in any way. And I knew that if I didn't disclose my condition, I would be suffering, and it would be a very sort of lonely experience, really. There was also a safety aspect to it. Seizures can strike at any time, so I felt that there should be somebody there with me in the office who knew what to do if I had a seizure. So safety played a large part in my decision to disclose my condition to my employers. I've been very fortunate in that I've had quite a few jobs across many different sectors: retail, hospitality, the youth sector. I've had many different jobs, and for each of those jobs I've probably disclosed my epilepsy at various points in the recruitment process. So some application forms I would mention that I have epilepsy specifically. Others I would be perhaps more vague about it and say just that I had an additional support consideration. Some jobs I applied for I didn't disclose until interview, and there was one job I didn't tell them I had epilepsy until after I'd been hired. So over the years and through working in these different sectors, it's been a lot of trial and error for me, and I've seen how that's sort of played out, and I've now come to the decision that going forward I think I'll always disclose my epilepsy at interview. I like the idea that going to the interview, you can show somebody what you're really about, and it's an opportunity to address any sort of stigma that might be attached to your condition. It's not just a black and white word on a page. You can go there, they'll see you smile, they'll see you in person, how professional you can be, see the enthusiasm in your face and your keenness to work. You can go there and show them what you're all about. So as I said, I totally understand anybody's decision not to disclose their condition, but personally for me, in my experience, I found that it has been actually the best thing to do to disclose my condition at interview. And it needn't be a serious conversation or take a serious turn whereby you say, I have something to tell you. You should feel that you can disclose your condition and not be prejudiced against, because the thought that always sits in my mind is, if you know that somebody is discriminatory and are prejudiced in their behaviours, is that somebody that you're going to want to spend 8 hours a day with for however many years you're at that company? Do you want to invest your time, your enthusiasm, your energy? Do you want to give that to somebody who's discriminatory and who isn't going to value that? I personally wouldn't want to work for anybody who is of such an attitude. So for me, I've found that I've had a lucky escape on quite a few occasions. I wouldn't want to work with anybody like that anyway.
That is a very, very good point. Thank you so much, Erin, for bringing that up. I completely agree with what you just said, and I think that as patients with chronic conditions, we should also keep in mind that we have to take care of our mental health as well, and this is a very big step into taking care of that. Next, I would like to give the floor to Marlene. She is also going to tell us a little bit more about her choices and decisions. Marlene, you have a few minutes. The floor is yours.
Hello, everybody. I'm really glad I can be here today. I'm 25 and I'm still in university. Therefore, I don't have too much experience at the workplace. But throughout my studies, I was able to work in various places in the service industry and do some internships, as well as doing some minor works for my university. And also, I have asthma. However, I'm lucky that I got it mainly under control through regular taking medication. However, once I am feeling like I'm having an asthma attack, I can take medication and it will come down quickly. I'm lucky in that case because I know that many people do not have that luxury of controlling it that easily. I have never really considered disclosing my illness due to the fact that it is so controlled and does not really affect my ability to work, or I also don't need security measures. I think this is also due to the fact that asthma is not as discriminated against or stigmatized as many other chronic illnesses, and that when someone sees me using my inhaler and they ask, oh, why are you using this? I can just say it's asthma, and no one asks any further questions. Everyone has heard of it by now, and everyone's like, oh, okay, cool, and then work goes on. So therefore, I never actively chose to not disclose or disclose. It was just, for me, always, this is how it is, and if I have to use an inhaler, I never considered anyone having a problem with this. However, I don't know how this will be in the future with experiencing more in the workplace, but I generally don't think that I would disclose.
Okay, thank you so much for showing us that side of things as well. This was the point of the whole discussion, to see what is the reasoning behind pro and con in this situation. And I think you did a very good job in explaining your reasonings, Marlene. Thank you very much. Up next, we have Cornelia Pauna from Romania. I hope I pronounced it correctly. Who is also going to give us her thoughts and decisions on this. Cornelia, the floor is yours.
Hello, everyone, and thank you. I'm really glad to be here. I am 26, and for 4 years I live with multiple sclerosis. And for 3 years I've been employed as mechanical engineer in an IT company. I haven't disclosed my situation at work, and I want to give you a bit of context why I decided not to do that. Firstly, it's because I live in a society that's highly judgmental and patriarchal, and we can still feel that we've stayed for too long in communism. Our society is not ready to hear that you are a patient and that you can also perform, especially with a disease such highly unpredictable as multiple sclerosis. In my case, not even my family supported me in disclosing it because I guess they knew what it meant. It meant stigma. It meant that I could not be taken into account for a promotion or for a challenging project, or not even get a job, as a matter of fact, and that people will look at me differently, either with pity or admiration. The thing is that the career is really important in our lives. It brings fulfillment and satisfaction, and you really don't want to be discriminated there. The society that I live in encourages us to disclose this situation only if it's either you don't have any other way, or you've already proven that you are valuable. Also, the same society encourages employers by law to avoid the trouble of hiring disabled people or people with chronic disease. So I guess what I want to point with all the things that I'm presenting is that this is a matter of education, and part of it is because we don't know our rights. And so I guess everybody goes with the flow, and the flow is afraid of stigma. I just want to end by saying that for a year now, I'm part of a patient organization in my country, and also, of course, participated in STIPA. And so my horizon has changed, and I do want to disclose this situation to my working place. But I just wanted to take the opportunity and share this with you. So thank you for the opportunity.
Thank you very much, Cornelia. I think you were the perfect person to have as the last one to share their experience, because you started off on one foot and now you're thinking about a little bit changing things. Of course, after informing yourself and making sure this is one of the right decisions for you in that example. We received a question from Eleni Tonoru. I don't know how to pronounce it. I'm sorry. She's saying that this is an amazing report, and thank you for raising this issue, and that a lot of the elements that were mentioned have been advocated, and there is some progress for the disability inclusion ecosystem. The question is, have you thought of collaborating with entities and organizations that work in the disability inclusion in employment theme? I'm guessing somebody from the youth group board can answer this question. Please feel free to jump in.
Yeah, thank you, Borislava. So thank you for the question. It's very relevant. We are not the first ones raising this issue, I believe, and the topics of disability and chronic conditions are very much overlapping in a lot of ways. So yes, as we plan this to be a strategy and not just a one-time event, yes, I'm not sure if we are going to get there. It would be really nice, and we are referencing some of the work that has already been done in the report. We try to build on that, especially when developing the survey. If you have any suggestions how to do it, we are all ears. So please make sure to write to us. We are a bit lost in here. So thanks for any suggestions.
Thank you very much for taking the question, Yvette. I think that's a very good step also towards future collaborations, and I'm sure that people that already have information on things like this can contact us on our email or social media pages. Everybody is going to receive a follow-up email from this webinar, so please feel free to also voice your suggestions there. Another question, maybe towards one of the panelists from this last discussion, is some people may wonder, what does it mean, stigma at the workplace? Can you give an example how the stigma influence your work process and work environment? Any of the panelists from this last discussion, please feel free to answer the question if you feel comfortable, of course.
Bori, I think this is a great question to channel us to the next discussion, actually, because there we'll be talking about helpful measures, and I believe the time is really up for going to the second discussion.
All right. In that case, thank you for the reality check, Yvette. We're moving forward to our next discussion, and just to give you a brief overview of why we thought this discussion was necessary for the webinar. This is the result of asking everybody who participated in the WASTE survey what would be some helpful measures to find a job. And as you can see, one of the highest suggested ones is training for the management level employees on how to manage people with chronic conditions in the workplace, which was mentioned a lot of times before in different projects and in different discussion groups of patient advocates. Introducing flexible working hours and the opportunity to visit a health specialist during working hours. This was, as Yvette already mentioned, a bit forced as well with the whole COVID situation, but it still needs some work and understanding, because I feel like at this point, if we showed that we can do our jobs perfectly fine from home in a situation like this, then I know that we can continue doing it afterwards as well. And of course, home-based and working from home offices. after you've seen what the majority of the young patient advocates have answered in the survey, I would like to introduce you to our next three speakers who are going to tell us a bit about what would help them find and keep a job, what are some good examples, and so on. So first we have Marcus Ward. Marcus, the floor is yours.
Thank you, Bori, and good evening, everyone. I am delighted to have the opportunity to talk with you briefly this evening. So my name is Marcus Ward. I am 28 years old and I am from Ireland. And I was born with two conditions, spina bifida and hydrocephalus, and so I'm a wheelchair user. Spina bifida is a neural tube defect and is often classed as a chronic condition. So I am a Spanish and French teacher. I work for myself, so I like to class myself as self-employed. And the reason for that is I work with groups and I work with individuals rather than in a school or any other education setting, let's say. So I graduated this year with a degree in Spanish and French from the Open University. So that was an online degree that I did. And it was a fantastic degree for me because it was extremely flexible and I could do it in my own time, and I wasn't limited to any barriers of accessibility, for example. So then as I said, I graduated this year and I wanted to get into some teaching, so I started with Spanish and French lessons with groups and individuals. Up until this year, there haven't been too many challenges when it comes to my employment, but I suppose having said that, this year has been very, very difficult for everyone, and when COVID-19 became a problem across the world, I had to make the decision to move online with my work. And again, thankfully, that wasn't too much of a problem because I had the resources to do that. So this year I've been working basically from my own apartment, and I do that with my laptop, and I do video calls and other I use other platforms to do classes with my students. And I suppose that also has its own flexibility because I can do that wherever. Yeah, so up until this year, I didn't have too many challenges, but I would have been going into people's homes, for example. So that can sometimes be a barrier when it comes to wheelchair accessibility. So just to talk briefly about some of the barriers that I have faced and challenges that I've come across when it comes to employment as a teacher. And so I'm just going to tell a brief story about a job that I was offered. And so I was offered a job in a school last year as a French teacher in a local school here, and I was tempted to take it, but I ultimately decided not to take it for various reasons. But I was in that same school just a few weeks ago, and I was in there to do a disability awareness.
Marcus, I think we lost you. I'm very sorry. Okay, yeah.
Can you hear me once again? Yeah.
Yes, we can hear you now. Thank you.
Sorry about that. Okay, so as I said, I was in that school doing a disability awareness talk, and afterwards I had a look around the school, and I realized a lot of the challenges that I would have faced if I had taken that job 1 year ago. For example, there were the elevators in the school, one of them was not working and was being used as a storage unit for all sorts of random things that you find in schools, like benches and chairs and things. There was a disabled bathroom that was also being used as a storage unit. So that became a huge issue once I saw it, because I had to bring it up to the attention of the principal straight away. So I knew that if I had taken the job, I wouldn't have had the opportunity to, I wouldn't have had the same opportunity as anyone else taking the job because of these issues. So in terms of a solution, I would have had to work with the school in trying to deal with all these issues. And so the elevators would have had to be fixed, for example. And when I brought it up to the principal, he was just so embarrassed that someone with a chronic condition like myself had never been in the school. So the school never realized the need to cater for someone like myself and cater for my needs. So that was very disappointing. Yeah, I've also been offered another job in another city, and I decided to turn that job down because I realized that it would be difficult for me to find accessible accommodation with a ramp at the door and things like that, an accessible bathroom. So those are, I suppose, just a brief summary of some of the issues that I have faced as a young patient with a chronic condition when it comes to employment. And yeah, so that's just, I think that's everything I have to say, really. So thank you, and I welcome any questions in a little while.
Thank you very much, Marcus. Your experience is very, very interesting, and I think brings forward a lot of very good points to be made in the future as well. And coming up next, we have Cornelia Flood, who has a very interesting profession as well. I'm sure she's going to tell us very soon. Cornelia, the floor is yours.
Thank you very much, Bori. Well, I am living and working as a registered nurse in Stockholm, Sweden, and I am working at one of the emergency hospitals here in Stockholm, so I am working shifts. And I have been open and honest about my condition of Crohn's disease since I sent in my resume for this work. And I am using my experiences as a patient advocate in my resumes. And I have only had very positive experiences of being open about my condition. And the most important thing for me is to have an open communication with my manager and my colleagues as well. And one of the very positive things about working shifts is that I am able to go for blood tests and doctor's visits on my spare time, and also to leave the ward for a few minutes to take care of these things during the work hours. And being open and honest about my condition has also made it possible for my colleagues to use me as they come to me to ask me about my experiences as a patient, and to get my views on being a patient and how they can make it better for our patients at the wards. Another very important thing for me at my work, and they have been very happy about helping me out, is a healthy work schedule. So sometimes I work day shifts from 7 in the morning to 4 in the afternoon, and sometimes I am working evenings. And this makes it possible for me when I am having a rough night, for example, and haven't been able to sleep because of pain and things like that, to rest in the early hours of the day to be able to work nights. And this is making it so that I don't have to be on sick leave as much as I would have been otherwise. Another great thing about being open about my condition at work is that I am able to have state financial support. So my employer doesn't have to pay for me if I am on sick leave for at least 14 days, because then the state pays my salary for this time. This had not been possible if I hadn't been open about my condition. And I have not had even one single negative comment so far at work about my conditions and being off for sick leave for many days the last year. But because I'm being open and honest about it, there is no one who can spread rumors about me because everyone knows what I'm dealing with. Yeah, I only have very positive experiences, actually. Yeah. Thank you.
That's great, Cornelia. Thank you. Thank you very much for sharing all of that. I guess we're really coming to the conclusion that as with healthy in brackets people, it's the same as it is with us. Everybody has a different experience. It really depends on a lot of things, but there's a lot of things that are overlapping as well, and this is what we're trying to focus on here. And next we have coming up Marlou from the Netherlands, who is also going to tell us a little bit about what would help her keep and find a job. Marlou, the floor is yours. Marlou is having a little bit of technical difficulties as far as I can see. So meanwhile, if you, I think it's good to say that we can go into some questions that we received. We have a question from Fanny Laura, who is also an ex-type of participant, who has a question towards Marlene. And it's saying, have you experienced during the pandemic, how is it affecting actually a patient with your type of condition? Have you had to explain yourself about the whole mask situation? Did it make any difference for you? And what would an employee with asthma or unable to use a mask do if he's required to still go to work, and so on? Marlene, if you feel comfortable answering.
Yeah, I am comfortable answering this. So I have no difficulty so far using a mask at all, and since I'm still at university, I am just at home, so no one asks me how I feel at the moment. So during the beginning of the pandemic, I was very worried that this could really affect me, but I've seen a doctor since, and he assured me that I was not a risk group anymore, like later on. And also my blood oxygen levels were still normal even when using.
I think we lost you for a second there, Marlene. Can you repeat, please?
Yes, I don't know was still what you were still able to hear. But my blood oxygen levels were always high, and even when I was wearing a mask at the doctor's office. So I have not experienced any difficulties through COVID with my asthma. I hope that answers the questions. If not,
Yeah, I think it does. And then thank you very much for your answer. I think it brought a lot of clarity, not only to what you're saying, but also towards a few other estimations, I would say, about people with asthma and the whole mask situation. We have a questions from Amaranta. She would like to know if all the conditions of the participants are considered a disability in their own country, since in Spain some of them aren't, and that leaves patients without much coverage in the job environment. This is thank you, first of all, thank you, Amaranta, for the question. I think it's this is going to take a while to answer for sure, but it's really something that I think it's good that you're bringing the focus to this, that in different countries across the EU, different conditions are taken as some as disabilities, others not, and there's not a common understanding of which ones are and which ones are not. So I really believe that this is something that we can focus on, and it's really good to talk about this as well. I'm trying to see if we can have a Marlou do her bid, but I can't hear you, Marlou.
Hi.
Okay. Ah, okay, perfect. Marlou, please, the floor is yours.
Hello. Yeah. You want me to keep it short? Because I can do that.
Yes, please.
Okay. So I think I was asked to tell a bit about not finding a job. And like I think 3 weeks ago or maybe 4, I found a job. So yay. But what I was really doing was like having a very big search in what was appropriate for me with my disease, because my disease is invisible, and nobody sees what what I have or something like that. What is important is for me is to tell everybody that I have a disease, because if you don't tell, they can't know, and I think that's the most important thing. Yeah, you should have in life. If you don't tell, they can't know. And also, if you're scared that an employer will not hire you or something, that employer is not worthy of you if he doesn't want to see through your disease and see your skills and your yeah, just, and that's what I want to say.
Thank you very much, Marlou. I think what you are saying also collides very well with a point that we heard earlier today.
Yeah, with Erin.
Exactly, with Erin's point as well. And I think we're really getting onto something there. Maybe we can now go to the Q&A session, which is going to be a bit shorter than expected, but still, we had a question earlier, which was about the stigma at the workplace, and can you give a concrete example of how stigma would influence your work process and your work environment? So I would like to address this question to all the panelists that we had, as well as the youth group members that are online right now. And whoever wants to take this question on and has a concrete example that might help our audience understand better what we mean by this, please go ahead. The floor is yours.
I can jump in. It's Yvette here. I will show my camera one last time. So for me, my condition, I have a rare condition which led me to have a liver transplant. So I'm taking immunosuppressive drugs on a daily basis, as science says now, until the rest of my life. So whenever I got into internship places or companies, I was open about my condition. I didn't really have any other chance because I knew them and they knew me from my patient organization work, and me being a patient advocate is on the internet. So it's pretty hard to cover that, but they really had the perception that I would miss work a lot, as I would be sick a lot, and not discriminating me in any ways, just based on what they knew about the condition. But then when I arrived to the companies and to the institutions, I could prove that luckily in my case, probably because of doing sports and just being lucky, I don't suffer that much of flus or regular colds, so I don't regularly have sick leaves. So I think these are the kind of prejudices that can be out there and that can prevent us, and that can prevent an employer from if they have two people with the same qualities or with very similar qualities, to pick one over the other. So I was afraid of this, but this never actually happened. Do we have any more questions? Yeah.
Yes, thank you very much, Yvette. There's a few more questions in the chat box, which I would like to share. Okay, so the first one we have is, are you planning on developing and scaling up this project in the future? Very, very good question. Yvette, maybe you would like to take that as well.
I'm a bit afraid people are getting too much of me, but yeah, so actually that's why we organize this webinar. We are looking for inputs from you, from the audience. We are opening up really our ears and just trying to find connections with other people working in similar areas and see if we can do something together. So I wouldn't say we have a concrete plan, but we would love to not stop here and to make any measures which can have a real impact on the long term.
Very good. Thank you so much, Yvette, for answering. The next question, it's more of a statement that we have, saying it would be great if we can find a way to be informed on our rights, also when bad things happen at the workspace, as was mentioned earlier. For example, how can we tackle the problem if our manager discriminates us, and so on. And here I would like to say that this is what we're hoping to achieve, and this is the Waste Project fact sheet and the report. We really want to try and use as a baseline to build on top all of these other suggestions that are coming up right now, and all of the information that needs to be handed out to the patients. We have another question that says, you said you recommended training for employers. What do you think is the best way to organize that?
Again, I have the answer for that, Bori. So yes. Actually, CRODIS Plus, the CRODIS Plus consortium just came out accidentally, I think in the last 2 weeks, very in line with us, with their recommendations, and they have a whole set of recommendations and the whole training material program on that. So we will make sure to also link that in our follow-up email that you will all get.
Thank you very much, Yvette, for answering that question as well. And with this, I would like to thank everybody for participating today. I would like to thank all our panelists, everybody who helped us and contributed to this project. It took a while to get to the end, but I think it's really going to make a difference. And I'm very happy to see the interest that it's getting from everywhere. I want to also share with you that everybody who registered and attended the webinar is going to receive receive a follow-up email with all the information about WASTE, the video, the fact sheet, how can you apply for the youth group, everything that you might interest you. And of course, if you want to know more, follow us on our social media channels, and don't hesitate to contact us. This is it from us. I really hope that everybody enjoyed this as much as we did, and we'll see you soon with more exciting content. Thank you so much, and have a good evening.